The primary purpose of an electrocardiogram ECG/EKG is to A. Measure blood pressure. B. Record the electrical activity of the heart. C. Determine lung capacity. D. Assess oxygen saturation. Answer B. An ECG records the heart's electrical activity, providing vital information about rhythm, conduction, and potential abnormalities. In a standard 12-lead ECG, how many electrodes are placed on the patient's body? A. 10. B. 12. C. 14. D. 8. Answer A. Although it is called a 12-lead ECG, only 10 electrodes are used, 4 limb electrodes and 6 chest electrodes. Which lead records the electrical activity between the right arm and left arm? A. Lead I. B. Lead 2. C. Lead 3. D. AVR. Answer A. Lead I records the potential difference between the right arm and left arm electrodes. What is the normal paper speed for a standard ECG recording? A. 5 mm per second. B. 10 mm per second. C. 25 mm per second. D. 50 mm per second. Answer C. The standard paper speed is 25 mm per second, allowing accurate interpretation of heart rate and intervals. One small box on ECG paper represents how many seconds? A. 0.02 seconds. B. 0.04 seconds. C. 0.1 seconds. D. 0.2 seconds. Answer B. Each small box is 0.04 seconds, while each large box is 0.20 seconds. Which waveform represents atrial depolarization? A. P wave. B. QRS complex. C. T wave. D. U wave. Answer A. The P wave corresponds to atrial depolarization, initiating atrial contraction. The PR interval represents A. Atrial contraction only. B. Ventricular depolarization. C. The time for impulse to travel from atria to ventricles. D. Ventricular repolarization. Answer C. The PR interval reflects conduction through the atria, AV node, and His-Purkinje system to the ventricles. A QRS complex wider than 0.12 seconds indicates A. Atrial fibrillation. B. Ventricular conduction delay. C. Bradycardia. D. Normal rhythm. Answer B. A prolonged QRS suggests delayed ventricular conduction, as in bundle branch blocks. Which electrode is considered the ground in a 12-lead ECG? A. Right arm. B. Left arm. C. Right leg. D. Left leg. Answer C. The right leg electrode serves as the ground, reducing electrical interference. Which condition is best identified by ST segment elevation? A. Myocardial infarction. B. Atrial flutter. C. Bradycardia. D. Premature atrial contraction. Answer A. ST segment elevation is a hallmark of acute myocardial infarction. What is the typical amplitude of a normal P wave? A. Less than 0.5 mm. B. Greater than 5 mm. C. Exactly 10 mm. D. Less than 2.5 mm. Answer D. A normal P wave amplitude should be under 2.5 mm in limb leads. Which chest lead is positioned at the fourth intercostal space, right sternal border? A. V1. B. V2. C. V4. D. V6. Answer A. V1 is placed at the fourth intercostal space, right sternal border, to monitor right ventricular activity. Which part of the ECG corresponds to ventricular repolarization? A. PR segment. B. QRS complex. C. ST segment. D. T wave. Answer D. The T wave reflects ventricular repolarization, or recovery after contraction. Artifact on an ECG is most often caused by A. Cardiac arrhythmia. B. Muscle tremor or patient movement. C. Myocardial infarction. D. Atrial flutter. Answer B. Artifacts are non-cardiac electrical interferences, commonly from movement or tremors. What is the normal heart rate range for sinus rhythm? A. 40 to 60 bpm. B. 60 to 100 bpm. C. 100 to 120 bpm. D. 120 to 150 bpm. Answer B. A normal sinus rhythm ranges between 60 and 100 beats per minute. A sawtooth pattern on the ECG is characteristic of A. Atrial flutter. B. Ventricular tachycardia. C. Atrial fibrillation. D. Junctional rhythm. Answer A. Atrial flutter often produces sawtooth flutter waves instead of distinct P waves. Which interval is used to calculate ventricular rate on ECG? A. PR interval. B. QD interval. C. RR interval. D. ST segment. Answer C. The RR interval, measured between two or waves, is used to calculate ventricular rate. The QD interval represents A. Ventricular depolarization and repolarization. B. Atrial repolarization. C. Time from atrial to ventricular conduction. D. Ventricular filling. Answer A. QD interval measures the total time for ventricular depolarization and repolarization. Which lead provides the best view of the inferior wall of the heart? A. Lead I. B. Lead 2. C. AVR. D. V3. Answer B. Lead 2 is commonly used to visualize the inferior wall and rhythm monitoring. If a patient's heart rate is irregular, which method is best for determining rate? A. Count large boxes between R waves. B. Use any single RR interval. C. Divide 1500 by small boxes. D. Multiply QRS in 6 seconds by 10. Answer D. For irregular rhythms, counting QRS complexes in 6 seconds and multiplying by 10 is most accurate. Ventricular fibrillation on ECG appears as A. Organized wide QRS. B. Chaotic, irregular baseline with no clear QRS. C. Regular sawtooth waves. D. Flat baseline. Answer B. Ventricular fibrillation shows chaotic electrical activity with no identifiable QRS, a medical emergency. A flat line on an ECG may indicate A. Asystole or loose lead connection. B. Ventricular fibrillation. C. Tachycardia. D. Normal sinus rhythm. Answer A. A flat line can mean true cardiac asystole or simply a disconnected lead, requiring immediate check. Which lead is typically used for continuous cardiac monitoring? A. Lead I. B. Lead 2. C. AVL. D. V6. Answer B. Lead 2 provides a clear view of P waves and rhythm, making it common for continuous monitoring. The U wave, if present, represents A. Late ventricular repolarization. B. Atrial depolarization. C. Early atrial contraction. D. His-Purkinje depolarization. Answer A. The U wave is a small deflection following the T wave, thought to represent late ventricular repolarization. Which electrolyte imbalance is most associated with peaked T waves? A. Hypokalemia. B. Hyperkalemia. C. Hypocalcemia. D. Hyponatremia. Answer B. Elevated potassium levels, hyperkalemia, cause tall, peaked T waves on ECG. A Holter monitor is used to A. Record ECG continuously over 24 to 48 hours. B. Monitor blood pressure only. C. Perform stress testing. D. Replace a pacemaker. Answer A. Holter monitoring is a portable ECG recording device that captures cardiac activity over 1 to 2 days. The J point on ECG is where A. QT interval starts. B. P wave begins. C. T wave ends. D. QRS ends and ST segment begins. Answer D. The J point marks the transition from depolarization, QRS, to repolarization, ST segment. Which rhythm is described as irregularly irregular with no distinct P waves? A. Atrial fibrillation. B. Sinus arrhythmia. C. Ventricular tachycardia. D. Junctional escape rhythm. Answer A. Atrial fibrillation lacks organized atrial activity, creating irregular rhythm without P waves. When placing chest leads, which landmark helps locate the fourth intercostal space? A. Angle of Lewis, sternal angle. B. Clavicle midpoint. C. Umbilicus. D. Acromion process. Answer A. The sternal angle is a key landmark for locating intercostal spaces accurately. What is the purpose of calibration on an ECG machine? A. To reduce electrical interference. B. To verify accuracy of paper speed and amplitude. C. To measure patients' blood pressure. D. To replace missing leads. Answer B. Calibration ensures the ECG machine records at standard settings, typically 10 mm per MV and 25 mm per second. Which condition shows a delta wave on ECG? A. Bundle branch block. B. Atrial flutter. C. Myocardial infarction. D. Wolff-Parkinson-White syndrome. Answer D. A delta wave, a slurred upstroke in the QRS, is typical of Wolff-Parkinson-White syndrome. An inverted T wave may suggest A. Myocardial ischemia. B. Normal sinus rhythm. C. Electrolyte balance. D. Healthy repolarization. Answer A. T wave inversion is often a sign of ischemia or strain in the myocardium. Which chamber of the heart is primarily responsible for initiating the electrical impulse? A. Right ventricle. B. Left atrium. C. Right atrium. D. Left ventricle. Answer C. The sinoatrial SA node in the right atrium generates the heart's primary electrical impulse. Which lead placement error may cause inverted P, QRS, and T waves? A. Left arm and right arm reversed. B. Chest leads too low. C. Right leg electrode disconnected. D. V6 placed too medial. Answer A. Reversing RA and LA electrodes causes inverted waveforms in lead and often misinterpretations. Which test evaluates cardiac response to exercise? A. Holter monitor. B. Stress test. C. Echocardiogram. D. Telemetry. Answer B. A stress test monitors ECG while the patient exercises, revealing exertion-related abnormalities. In which situation should a CCMA stop a stress test immediately? A. Mild sweating. B. Patient breathing heavily. C. Increase in heart rate. D. Patient reports chest pain and dizziness. Answer D. Severe symptoms such as chest pain, dizziness, or ST changes require immediate test termination. Which device delivers electrical shocks to restore normal rhythm? A. Pacemaker. B. Defibrillator. C. Holter monitor. D. ECG machine. Answer B. Defibrillators provide electrical shocks to correct life-threatening arrhythmias like ventricular fibrillation. Which heart block shows progressively lengthening PR intervals until a QRS is dropped? A. First-degree AV block. B. Third-degree AV block. C. Second-degree Mobitz 2. D. Second-degree Mobitz I, Wenckebach. Answer D. Mobitz I is characterized by progressive PR prolongation until a ventricular beat is dropped. In third-degree heart block, the atria and ventricles A. Beat together normally. B. Have no relation, beating independently. C. Beat faster than normal. D. Show only ventricular activity. Answer B. Complete, third-degree, block means atria and ventricles contract independently without coordination. Which lead is located at the fifth intercostal space, midclavicular line? A. V2. B. V3. C. V4. D. V5. Answer C. V4 is placed at the fifth intercostal space, midclavicular line, an important precordial landmark. A pacemaker spike before every QRS indicates A. Atrial pacing. B. Fusion beat. C. Dual chamber pacing. D. Ventricular pacing. Answer D. A spike preceding each QRS shows ventricular pacing from an implanted pacemaker. Which part of the heart does V5 and V6 best monitor? A. Septal wall. B. Lateral wall. C. Inferior wall. D. Posterior wall. Answer B. Leads V5 and V6 reflect electrical activity of the left lateral ventricular wall. Which arrhythmia is most life-threatening? A. Atrial fibrillation. B. Premature atrial contraction. C. Sinus tachycardia. D. Ventricular fibrillation. Answer D. Ventricular fibrillation results in no effective cardiac output and requires immediate defibrillation. Which ECG change is seen in hypokalemia? A. Peaked T waves. B. Short PR interval. C. ST elevation. D. Flattened T waves and U waves. Answer D. Low potassium flattens T waves and produces prominent U waves. If an ECG shows electrical activity but the patient has no pulse, this is called A. Asystole. B. Pulseless electrical activity. C. Ventricular tachycardia. D. Normal sinus rhythm. Answer B. Pulseless electrical activity, PA, means organized electrical signals exist without mechanical contraction. The most accurate method to measure heart rate on ECG is A. 6-second method. B. 300 method. C. 1500 method. D. Estimation by eye. Answer, C. The 1500 method, dividing 1500 by small boxes between our waves, provides the most accurate rate. Which condition often requires anticoagulant therapy to prevent stroke? A. Atrial fibrillation. B. Sinus bradycardia. C. Junctional rhythm. D. Ventricular bigeminy. Answer, A. Atrial fibrillation increases clot risk in atria, so anticoagulants are used to reduce stroke risk. In a patient with left bundle branch block, QRS complexes appear. A. Narrow and upright. B. Wide with notched or waves in lateral leads. C. Absent with flat baseline. D. Chaotic without rhythm. Answer, B. Left bundle branch block produces widened QRS with distinctive notching, especially in leads I, V5, V6. Which component of the conduction system delays the impulse to allow ventricular filling? A. SA node. B. AV node. C. Bundle of His. D. Purkinje fibers. Answer, B. The AV node delays conduction so atria contract fully before ventricles depolarize. Which waveform abnormality is typical in pericarditis? A. Diffuse ST elevation. B. ST depression in V1. C. Inverted P wave. D. U wave prominence. Answer, A. Pericarditis causes widespread ST elevation across multiple leads rather than localized changes.